what we see is in a more mature clinical labeling model is that they reduce friction in three specific ways. So first, ownership clarity. So there is clear decision-making across regulatory, clinical, supply artwork. So approvals do not stall because ownership is unclear. Second, language consistency. So ensuring controlled terminology, consistent intent from master English label text through to country-specific label text, which reduces reconciliation work later. Third, controlled change execution. So updates across countries handled through impact-driven decisions rather than reopening everything every time something changes. Now, most sponsors already have elements of these three in place. The difference is not whether or not these elements exist, it's how consistently they are applied in execution. And when they are applied well, the outcome is fewer decisions, fewer cycles, and more predictable timelines. The real differentiator is not just having the right principles, it's about how these principles are operationalized into the workflow.